We're going to get started in just 1 minute. Thanks for joining us. Hello, everyone, and welcome to the Status of Women in Oklahoma release and Next Steps press conference. I'm Wendy Doyle, President and CEO of United We. Today, I am joined by Dr. Laura Ahlstrom, who is the Assistant Professor at the Spear School of Business at Oklahoma State University, and who is the lead researcher of this project. We are here to share just a glimpse of the Status of Women in Oklahoma research report, which is the result of a year-long research study that evaluates many challenges for women, including employment and earnings, childcare, poverty, social insurance, and civic engagement. Before we look at the data, let me tell you a little about United We. Our mission is to advance all women's economic and civic leadership to make meaningful change. Through our work over the last 31 years, we know too many women remain on the sidelines because they face unnecessary obstacles such as pay inequality, access to affordable childcare, limited family leave, entrepreneurship restrictions, sexual harassment, and inadequate public policies. All of these issues disproportionately impact women, yet they are solvable. Everything we do at United We is rooted in data. We use evidence-based research to identify specific barriers to women across the nation and develop smart, practical solutions to overcome them. More than ever, we must unite to advance and support policies that strengthen Oklahoma women and families for the economic development of the state. I'd like to thank two funders who have made this important research possible: the Ash Grove Charitable Foundation and the Spear School of Business at Oklahoma State University. We believe in the power of partnerships at United We and sincerely appreciate the generosity of both organizations who are invested in transforming the futures of all Oklahoma women. Now, I'd like to turn it over to Dr. Ahlstrom, who will share general themes and specific barriers to women's full economic participation here in Oklahoma. Dr. Ahlstrom.
Thank you, Wendy. As Wendy said, my name is Laura Ahlstrom, and I'm an assistant professor of economics at Oklahoma State University. Women in Oklahoma face many challenges economically and politically. Some of you may be familiar with this first statistic, which appeared in the most recent study by WalletHub, which examined the best and worst states for women's equality and found that Oklahoma ranked 51st out of the 50 states and Washington, D.C. The state had low rankings both in terms of women's economic and social well-being and in women's health care and safety. In this study, we explore many of these issues using publicly available data. Most of our data comes from the U.S. Census Bureau for the years 2015 through 2019. Although some of the 2020 census data has been made available, a lot of it is not yet available or broken down by gender. So we have used the most recent data that is available. We also use data from the Bureau of Labor Statistics, as well as from different departments that are part of the state system. Next slide, please. We begin with looking at education, and this figure shows us the percent of adults 25 and over with a bachelor's degree by degree field. And we can see the US and women in Oklahoma, males and females. And compared to women in the United States, women in Oklahoma have earned larger shares of degrees in education and in science and engineering related fields. And those are things such as nursing, architecture, and physical therapy. Women in Oklahoma have, however, earned smaller shares of degrees in business and in science and engineering fields such as mathematics, computer science, engineering, and the physical, natural, and social sciences. One good thing for women in Oklahoma is that in 2019, a larger percentage of women in Oklahoma between the ages of 25 and 64 had a bachelor's degree or an advanced degree. So more women in Oklahoma had these degrees than men in Oklahoma, but women and men in the state are still lagging behind their US peers. Next slide, please. This slide looks at the gender earnings gap, and the figure shows the median gender earnings gap in the United States and Oklahoma between 2015 and 2019. And what we can see is that during this time, women in Oklahoma earned an average of 74.5 cents for every dollar earned by a man in the state. The average for the United States as a whole during that time was 80.8 cents. The gender earnings gap is also larger for women of color. Hispanic women in Oklahoma earn about 50 cents for every dollar that a white man earns, and Black women earn about 58 cents for every dollar that a white man earns. If current trends continue, it's estimated that women will not receive gender earnings parity in Oklahoma until the year 2076. Some of the gender earnings gap may be related to women's lower labor force participation. So in Oklahoma, 56% of women participated in the labor force compared to 59% of women in the United States as a whole. Another issue is that a large number of the minimum wage workers in Oklahoma are women. About 6 in 10 of the minimum wage earners in Oklahoma are women. Next slide, please. Thank you. This figure shows the adult population in Oklahoma who are without health insurance, and this shows from 2015 through 2019. And we have the total Oklahoma in blue, males without insurance are in orange, and then females without insurance are in gray. And you can see that the average for these years has been anywhere between 12 to 15%. The percent of women in Oklahoma without health insurance increased over that time. And the national average for all adults without health insurance in 2019 was 9.2%. So there are more Oklahomans without health insurance, both male and female, than in the United States on average. Also, in 2022, Oklahoma had the second highest number of uninsured women in the country. The state has taken efforts to expand Medicaid enrollment. Between 2015 to 2019, 18 to 19% of women in Oklahoma were enrolled in Medicaid compared to 21% of women in the United States. However, in July of 2021, the state implemented a Medicaid expansion, and it has increased the number of enrollees in Medicaid to over 1 million, which represented a 12% increase since 2013. Next slide, please. The next couple of slides discuss childcare access and childcare costs. This slide shows the number of licensed facilities in Oklahoma between 2015 and 2021. And this data comes from the Oklahoma Human Services annual reports. And what we can see is that during this time, there has been a sharp decline in the number of licensed childcare facilities in the state. A 28 statistic found that 55% of Oklahomans live in what's referred to as a childcare desert. And that means that it's a census tract with more than 50 children of childcare age that either have access to no licensed childcare facilities or have access to so few facilities that the ratio of children to facilities is 3 to 1. So there are 3 times as many children as there are spaces in available licensed childcare facilities for many Oklahomans. Also, in 2020, the pandemic hurt childcare access in the state, and there was a sharp decrease in the number of licensed facilities to 2,685. In 2021, due to efforts related to pandemic relief and assistance, the number increased by 10% to 2,964. However, that is still fewer licensed childcare facilities that existed in the state in 2019. Next slide, please. In looking at childcare costs and affordability, this slide shows us the number of children receiving childcare subsidies in Oklahoma from 2015 through 2021. And we can see that there has been a decrease in the number of children receiving the state childcare subsidy. Also, the state's subsidy reimburses childcare providers for only about 60% of the true cost of providing care. That pushes a lot of the cost of childcare onto low-income families. The federally recommended reimbursement rate is 75%. The annual childcare cost in Oklahoma in 2020 was fairly expensive. For an infant, the cost was $8,940 for the year, or $745 for the month. And that is more than the cost of annual in-state tuition at a 4-year regional public university in Oklahoma. If you wanted to have 2 children in childcare, an infant and a 4-year-old in 2020, that cost would be approximately $15,702, so nearly double the cost for just one child. In terms of the cost of childcare as the percent of people's income, to have an infant in childcare, it would be roughly about 11.7% of a married couple's income and about 39.6% for a single parent. To have 2 children in childcare, it's roughly 21% of a married couple's income and just under 70% of the income for a single parent to have 2 children in childcare. Next slide, please. This slide looks at poverty in Oklahoma, and this shows the percent of women in poverty by county across the state. And we can see that that ranges by county from a low of about 8.5% to a high of just under 30%. The Oklahoma County average was 18.4%. And among adults aged 25 to 64, women in Oklahoma have higher poverty rates than men in the state. And women in Oklahoma also have higher poverty rates than women in the United States on average. Also, the poverty rate for women in Oklahoma aged 65 and over has been increasing. And the state is this most recent data from the state, the 2020 census, indicates that the state is aging. And so this idea that the poverty rates for elderly Oklahomans is increasing is a concern. Next slide, please. This slide shows civic engagement and voter turnout. And the figure here is the percentage of women in state legislatures in Oklahoma and then in the United States on average. And this shows from 2015 through 2021. And this data comes from the Center for American Women in Politics. Women's representation in the Oklahoma State Legislature decreased from 2015 through 2018 from about 14% to about 12.8%. In 2018, there was a record number of women elected to the Oklahoma State Legislature. Women won 23 of the 101 seats in the Oklahoma House of Representatives and 9 of the 48 seats in the Oklahoma Senate. In 2021, women comprised 20.8% of the Oklahoma State Legislature, which is less than the average in the United States of about 31% in state legislatures across the United States. Voter turnout indicates that between the 2014 and 2020 elections, a larger percentage of women in Oklahoma voted compared to men in Oklahoma, but both men and women in Oklahoma vote at lower rates than their peers in the United States. So women in Oklahoma vote less than women in the United States. Next slide, please. This slide shows the effects of the COVID-19 pandemic on the monthly unemployment insurance claims broken down by gender. And this shows from 2022 to 2020, from 2020 to 2022. And so we can see that at the start of the pandemic, in April of 2020, the number of monthly unemployment insurance claims was greater for women in Oklahoma than for men. By June of 2020, we see a large spike for both men and women. And in that month, the state received over 188,000 unemployment insurance claims. We can see that unemployment insurance claims dropped considerably. And by the fall of 2021, the numbers of men and women filing for unemployment were closer to the pre-pandemic levels. However, in the second quarter of 2020, the unemployment rate for women in Oklahoma was 12% compared to the 8% unemployment rate for men in the state. And today, the unemployment rate for both men and women in Oklahoma is very low. It's right under 3% or right around 3%. So this is certainly, something to consider. One of the things is that we would, in future research, we would like to explore a little bit more about the effects of the COVID-19 pandemic and also see what we can find out from the 2020 census data. And I will turn it back to Wendy now.
Thank you so much for that insightful overview of the research, Dr. Ahlstrom. As mentioned, this is only a small glimpse of the research. A complete report is available for download on our website at united-we.org. Now, let's talk about some next steps, which I mentioned in the beginning. We believe at United We that it is our collective responsibility to take this research information, identify creative solutions, and then really get to work to educate elected officials, corporate and community leaders, and then roll up our sleeves to impact lasting systemic change. At United We have a 5-part plan we'd like to implement over the next 2 years. First, we'd like to conduct research through statewide town halls, building on this quantitative research report, The Status of Women in Oklahoma. We will hold at least 5 town halls statewide to hear firsthand from Oklahoma women. This will be the single largest effort in the history of Oklahoma to listen and address the economic needs of women. Secondly, we'd like to establish an Oklahoma Women's Economic Development Task Force. We will convene at least 25 diverse women by geography, industry, occupation across the state to support town halls and inform next step recommendations in the final town hall report. The task forces that we've implemented in Kansas and Missouri have been critical and influential to change. Third, we'd like to research child care licensing requirements county by county and city by city. A significant problem impacting the growth of Oklahoma's economy and workforce development is childcare. We would like to study county and city level childcare licensure regulations, which directly impact affordability and accessibility. This research will build upon a national state-by-state childcare licensing study evaluating state-level childcare licensure requirements that United We will be conducting over the next 2 years with a funding investment from the Ewing Marion Kauffman Foundation. Fourth, we'd like to convene, educate, and advocate. We will identify and build a nonpartisan Oklahoma advocacy and policy strategy and conduct a statewide advocacy and education campaign that articulates the need for economic and civic changes that benefit Oklahoma women. We will create an ambitious yet achievable nonpartisan systems level change agenda focused on women's priority needs and convene women across the state to build momentum for change. And finally, to further our appointments project. Our appointments project works to empower women and create vibrant and inclusive communities by increasing the gender diversity and representation of appointed civic boards and commissions. While our program already exists in Oklahoma City, we'd like to expand further across the state at the city, county, and state level to increase gender parity on boards and commissions. All of this work is estimated to cost about $550,000 over the next 2 years, but we cannot do it alone. So we are actively having conversations and seeking funding partners to help execute this important plan in Oklahoma. Now, I'd like to open it up to our participants today to answer any questions that you may have. Feel free to drop questions in the chat. or unmute yourselves, and Dr. Ahlstrom and I are happy to answer your questions. Any questions?
Yeah, so this is Nick Camper with KFOR. You talk about on one of your next steps, you talk about OK Women's Economic Task Force, and you have that in other states.
Yes.
How exactly, or what exactly have you seen in terms of improvements with your work already in other states that you can bring to Oklahoma?
So what we can bring to Oklahoma is, as we've identified, a nonpartisan policy agenda, but it's really informed and driven by our research. So the status of women in Oklahoma is critical to having those important conversations. The economic task forces that we have done in Missouri and Kansas have really helped us encourage women to participate in the town hall sessions. It's really important not only that we have the quantitative information, but really hear firsthand from Oklahoma women to test and ensure that we have outlined the priorities accurately. Also, we've been instrumental just with that work to engage our policymakers with us in the town hall sessions, but also in the release of the town hall report. And then that has really been a tool and a guide star for both Missouri and Kansas to identify, not only for our organization, United We, but for other policymakers too, on what priorities should be to impact women and families. And again, in both states, it's been critical to have a workforce development strategy that's been a priority of both governors down through the legislature. And this has really helped inform, educate, and guide them to prioritize where we can lean in and really elevate growing the economy. I would also just add that a guide star for us as an organization is utilizing the McKinsey Global Institute's research report for Oklahoma, that if we can get women back to work, participating as entrepreneurs or back in the workplace, we can have the potential to grow Oklahoma's state economy by as much as 15% by 2025. So a lot of components to answer your question, but it's, a compounding effect of us all working together and having informed conversations and prioritizing where we can make the greatest impact.
Wendy, we've also had a couple of questions in the chat. The first one here is, how do you select the task force, and how do you identify where your town halls will be located?
That's a great question. What's really important is that we have representation not only from the metropolitan communities, but we also have representation from rural communities as well. And we want to make sure that we invite and include all women to be a part of the conversation so we can accurately and hear firsthand. So the task force has been identified just by having conversations with corporate leaders, but also our policymakers to help us ensure that we have good representation from around the state. And we want to make sure that we have representation by industry. For example, that we have the veterans community represented, that we have a women farmer or a rancher represented, and that we have ethnicity represented as well. That's extremely critical, as well as the business community, as well as a small business owner. So we want to make sure that it is diverse as possible, and we just engage and have a number of conversations to identify the right leaders to be a part of that task force. Is there another question? Sarah, or I'm sorry, Stephanie?
So we had another individual, Teresa, talk a little bit about childcare and the importance of pre-K. If you want to share maybe just a little bit about the national study and how that might, look at the different city by city and county by county.
Yes. So, as a result of some of our work in Missouri and Kansas, we've really identified the supply not meeting the demand, especially coming out of the pandemic and with the childcare facilities. And one of the pieces that we've learned as a barrier is the licensing requirements. And we know every state has a different licensing requirement. So we really wanted to get to work to understand which state is doing it extremely well. And can we learn from some best practices and bring that to Oklahoma, to Kansas, to Missouri. So that's really the intention of the national research studies, to really learn and identify best practices. But what's really critical is as you dial it down to a county and city level, it's even more significant what we're learning. So, as the margin for profit within the childcare industry is so razor sharp thin, that we want to look at, again, keeping the health and safety of our children first and foremost as the priority, but are we making it too difficult for new businesses to open up in the childcare sector, to really open up to meet the supply and demand, but also really leaning into quality and affordability. We know that Oklahoma families are, this is a kitchen table conversation. Childcare is really significant, as Dr. Ahlstrom identified. So it's critical that we kind of chip away and take a different approach. And our organization has done a lot in the occupational licensing space. This fit nicely with some of our priority work.
Thank you. We have another great question here. What issues would the Women's Task Force address within economic development and through the workforce lens? And the second part of that question is, how would nonprofits present this as an economic priority to board members?
So the opportunities for Oklahoma will really be identified as a result of having the town hall discussions. So, it's critical. We've got the status of women report, but then we really need to hear again firsthand what the critical issues are. Based on those conversations, then we will put together a town halls report of Oklahoma of identifying what the opportunities are based on what we heard from women. We can obviously, glean from the research report here, childcare probably is going to be elevated as a top priority. So the opportunities will be identified, engaging the task force based on the status of women research report and the town hall's qualitative data combined. So that'll help guide and identify, what the priorities are. And I think there was a second part of that question, just how would nonprofits present this as an economic priority to board members? We really don't want you to wait for the task force or the town hall's work to be completed. There is some great information that's already identified in this status of women in Oklahoma research report. So it is our intent that we want this research to not just sit on a shelf, to really be utilized. And we've invested in this for all Oklahomans. So please take this research report now, inform and educate your board, and identify strategic priorities that you can implement based on this research information. And then when we complete, we'll circle back and further have a conversation about, here are some additional priorities that we've identified.
Great, thank you. One more clarifying question. Where would the town halls be held in Oklahoma? Can you share a little bit about how that's identified?
Yes, well, we've identified and have said that we'd like to have a minimum of 5 town halls. And from our learnings here in the Midwest, that really gives us a good cross section and start to see some common themes when you have about 5 town hall sessions. We for sure, again, as I mentioned, want to have the cross section of metropolitan and rural representation for the town hall. So stay tuned. This hasn't been outlined yet. We, want to be intentional, where we host these town halls. And in addition, we want to make sure that we have good representation. So we will also include a virtual component in Missouri and Kansas. We've done a statewide virtual opportunity. So if you can't physically get to a location, there's still yet an opportunity for your voice to be heard. So stay tuned on that. We certainly will keep you informed once we have those identified, but we'll be strategic and intentional to make sure we're in all corners of the state and have the rural and metropolitan communities represented. I know we're getting close on time. Any final questions.
I do have one more question. So you brought up there's a high number of women that are in poverty in Oklahoma. At the same time, the state has passed bills to privatize the further expansion of Medicaid, and then also on that note, we're the second highest state with or the second highest number of uninsured women in the United States. So basically, do you see legislation like that having a direct negative impact on your goal of having or getting more women insured in the state? Does something like that directly affect it?
That's a great question. And we have not investigated that thoroughly yet, but we certainly want to be open to what policies are already being discussed and have passed for the state. So I'm sorry, I'm not going to be direct in answering your question directly, but what we would say is we want to, we would take a look at that. Dr. Ahlstrom, do you have, any comments to add on that point?
Yeah, that's a really good question. And since the Medicaid expansion was only really passed and implemented just about a year ago, with the data that we had for this particular study, we really couldn't examine those issues. All I was able to do was find a little bit about the increases in enrollment, but to really examine an impact of that policy, I think we would need a little bit more data. So yeah, it's something to definitely look at in the future. So thank you for that question.
Great. I know we are right at time, Stephanie. Do you think we can take one more question, or do you think?
Yeah, if somebody else has one more question verbally that they would like to share, please go ahead.
Okay, with that, we are so grateful that you joined us this morning. Again, please utilize the research. We invested in this for everyone in Oklahoma. You can find that again at united-we.org. Thank you so much for your good questions and joining us today, and we hope you have a great day.